Matthew Holt, healthcare hitting home. I'm like, I have a terrible cold and I'm so stuffy. It's the September 1st episode of Health Tech Deals.
Oh, Jessica, 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 what are we going to do with you? It's the dog days of summer, and you have that worst of all things, a summer cold.
It's the worst.
Actually, I had one when I went on vacation, and there was like all kinds of horrible stuff coming out of my nose and gunky and whatever. And I kept on having COVID tests, and it's not COVID. So,
Same.
yeah.
COVID.
So,
Just
who knew you could get some kind of respiratory infection and it wasn't COVID, but you can. Well, the good news is it's the dog days of summer. Everybody else you know is at Burning Man. So, there's probably nobody watching this or caring anyway. But there are a few deals. There's no real healthcare news, apart from Donald Trump, betraying the national security interests of 68 nations. There's no other news. So we might as well just dive right in and go.
might as well. Before I have to blow my nose again. We have a limited amount of time. All right, go. Alma gets 130 million, brings her total up to 220. Is this Series D? Cigna Ventures, Optum Ventures, a bunch of people in this. Talk to me.
Yeah. This is Thomas Bravo as well, the big PE company. Remember, this was one you laughed at a couple of years ago when they said they were going to set up like renting out space to psychologists in WeWorks, and they completely spun it around now. So what they're now doing is delivering an entire practice management solution to clinic mental health professionals, which is like everything, right? All the kind of stuff that Think Health and others sell, the practice management to regular doctors. Esther Perel's on our advisory board. The guy who runs it, Harry Ritter, is ex-Oscar, and they've now got 8,000 mental health professionals on board. And now they're going to go out and start, grouping them together and negotiating them, getting them onto insurance and negotiating the health plans. So they seem to really, figure out a way to thread the needle around into not being Lyra or Ginger, but starting with an independent group. Interesting stuff.
Yeah, this one's fun to say. Fair Square Medicare, they get 15 million, brings their total up to 19. Define is in this one.
This is strange to me, right? Right at the time where GoCo and eHealth Insurance, the two biggest publicly traded Medicare brokers, are dying. I mean, like their stock was 40 times what it is now, 18 months ago. Lynn Sharon O'Keefe and her friends at Define have figured out that there's a room for a new Medicare broker. And this one says deliberately they're not going to be swayed by the highest commission. They're going for the lowest. They're going to go for the best plan, even if they make less money.
Sure. All right, Brian Dolan, other secret health tech funding deal, Teledoc's founder, Recuro Health, 27 million. What do we know about this?
Yeah, they're basically building your chart, the primary care with mental health, all this other stuff, that they're building that. They bought a company called You Do Test, which I was advising a while ago, was one of the things.
I remember them.
Yeah, a bit of stuff. Interesting. Michael Gordon is the founder, used to be kind of Teladoc.
All right, what about Canvas Medical? 24 million.
So this is a little bit, this one happened a while back. I wanted to get it in there. This is a newfangled new EHR company. So like Elation and to some extent like a bit like Zeus. They're building a full stack, ambulatory EMR and digital health developer platform. M13, Haystack, Upfront Ventures, a bunch of other players are in this. So this is kind of hinting at the fact there was some back and forth, right, with all of our old friends in the kind of primary care space who've been building their own stuff. Now there are more and more digital health companies looking for solutions. Sort of Zeus is somewhat in this game as well. And none of the current provider, none of the sort of Athena Health and the Epics seem to be applicable for these guys. So these folks think that there is a room for them there, as does Elation, which had a much bigger round a couple of months back. Maybe they're right. I did see Jay Parkinson, our old friend, on Twitter the other day saying that he was building yet another new EMR.
I saw that too.
Like this. I'm going, why isn't he buying these guys? Something to do with the fact that he wants virtual messaging as the main component of the EMR. And
I saw that too. So there's something about the notes on care, like if you had the care notes, you had the crux of everything. I saw that tweet also.
Yeah, he's.
I don't understand. Like, okay, so how come everybody's building their own EHR? Like, I mean.
Well, I mean,
how are Epic and Cerner multi-million-dollar businesses? You can just make one of these right now. Like, I might be making my own EHR later.
Well, you remember Dr. Lyle with his was it Keynote, the one was it the right name?
Yeah, it's
Well, the one they did where they were going to do Epic because they wanted
Epic integration with
they wanted to
with
integrate
telehealth.
with the big health systems.
Yeah.
All of these new EHRs are either independent practice people or for these new digital health companies which are trying to like compete with the big health systems. But if you remember, Iora, One Medical, Crossover, they all built their own because they felt that Epic, Cerner, and even Athena and those other ones back in the early teens didn't
do what they needed them to do. Yeah.
And so maybe the Canvases of the world and the Elations of the world are going to do what they need to do. Or maybe we'll just keep building our own stuff because we don't trust anybody else.
Either way.
We should be building our own video conference system. Who needs Zoom for this?
Oh, Zoom. What would we do without it?
Well, so are you going to go and get better?
Yeah, I mean, it's just stupid cold, but you know how that is. You just feel crummy.
Yeah, I understand that taking a lot of cocaine is a good way of curing it.
Oh, is that right?
Maybe my medical advice is 120 years old, but I would.
Wow, okay. Well, guess what I'm doing this weekend to follow along and see how that goes. I'm over on Twitter at Jess DaMassa. I'll be sure to tag at BoltyBoys so he too can watch those exploits and live them in real time. And to never miss an episode of Health Tech Deals, head on over to thehealthcareblog.com and sign up for our email newsletter and get all the best of the blog delivered to your inbox.
Actually got delivered this week, so no.
I think that was the first one. That was the first one that went out in like a month and a half, right?
Oh, rubbish. The first one went out in 4 weeks, but
okay, sure.
It was August. No one's paying.
Oh, that's rubbish. A month and a half, but 4 weeks, yes. Okay, sure. Take great offense to those extra 2 weeks I added on there. All right, guys. We'll see you. I will. Thank you. Bye.